Hospitals in Dane County want you to know they expect to start getting a COVID vaccine soon, but you can't reserve one just yet.
Amanda Quintana is at UW Hospital with more on how providers will serve as regional storage hubs as they prepare to administer and show people the vaccines are safe.
Yeah, well, the reason why they need to have these central storage locations is because the Pfizer vaccine has to be stored at nearly 100 degrees below zero. And here at UW, they can store 300,000 vaccines like that. Now, most of those are reserved for healthcare workers, but they hope that when you can get in line to get a vaccine, that you will because you're confident in it.
I think there's still a lot that's kind of being fleshed out and determined, but the general approach is understood and I think is going to be effective.
That approach includes bigger hospitals with freezers like UW's and SSM Health, both ready to store vaccines.
When the vaccine gets out of the ultra-cold storage freezer, the vaccine is good for 5 days in a refrigerator.
Exactly how DHS will then distribute those vaccines to smaller rural hospitals is still being worked out. It'll take multiple rounds of deliveries and months to get through healthcare workers, just 13,000 working for UW Health alone. Then those in long-term care facilities and first responders before the general public can start being vaccinated.
So hopefully by the time we get to that point in the spring, the vaccine will be tried and tested and people will feel more comfortable with it.
A Pew Research study shows more Americans are feeling comfortable getting the vaccine. It's now at about 60%, up from around 50 back in September. But people still have a lot of questions. UW Health is hoping to answer them once the FDA approves a vaccine, which could happen on Thursday.
Without the FDA emergency use authorization, we don't have all of the information from the trials as well. And so we should hear more about that later this week, hopefully, and we'll be able to start getting more information out.
Both UW and SSM Health will then be focusing on education, making sure people understand how quickly this was rolled out doesn't affect its safety or effectiveness.
It's not by cutting corners. It's by taking some of the red tape and other things out.
Now, both of the healthcare systems are still trying to iron out a plan for how to get that first round of vaccines just to their employees. UW tells me that they are thinking about doing drive-through vaccinations, but SSM says that they're not thinking about going that route.